Delirium is 4 times more likely in seniors versus the normal population, and about 15% of patients can come, to the emergency department with delirium, and about 60% can develop delirium within the hospital setting. So it is a huge problem that can certainly affect length of stay, quality of life, how people recover in hospital given how frail and complex they are. It's certainly something that family members, healthcare professionals, we all need to be aware about. Delirium is an acute confusion that comes upon very suddenly. People can go from very confused and maybe a little bit restless, they can become suspicious, or even they can become very somnolent, withdrawn, and very sleepy.
From the point of view of a caregiver, obviously it would be very important to be also on the alert to look for what's extraordinary, what's changed, what is new, what's not normally the person would do, and bring them to medical attention earlier rather than late. That would have a better prognosis.
We do an extensive workup to help identify what some of those potential precipitating causes are and treat them. And hopefully with treatment, the resolution of the confusion, it will go away and people will return back to how they were, prior to that acute episode. It can take days, it can take weeks, and sometimes delirium can persist for months in the most extreme cases.
My father passed away, sadly, at the age of 87. After 38 days at North York General, whereby he was brought in with dementia and in particular delirium. We brought him to the hospital and he was admitted because they were trying to see the source of delirium, whether it was physiological, and basically the team at North York, from nurses, nurse practitioners, geriatric psychiatrists, geriatricians, and generalists all worked together collaboratively to get to the source of it. And they left no stone unturned. They weren't just addressing my father's physical and mental needs, but they were addressing our concerns, constantly asking us what are our expectations as well, and answering all our questions. They reinforced what North York is known for, in that its patients come first and it's patient-centered care. I think we as family members can fill in the gap of observation to help the doctors and nurses perform their duties. You're giving them more information so they in turn can have a more effective care and treatment for the patient.
The most important thing is kind of get help early, and there's always help, there's always hope.